The Dr. Fazil Show is brought to you by Health Tips Media. The Dr. Fazil Show is intended for health educational purposes only, and complies with all HIPAA regulations. Enjoy the show.
Hi folks, welcome to Dr. Fazil TV show. I'm an internal medical specialist as well as kidney specialist. So today the topic for discussion, and before I go further, I have to let you know this is November 2023 of Dr. Fazil TV show. So thank you for coming in to see this show. So my goal would be to educate my audience on a new topic today, which is very common: leaky bladder, urinary incontinence, or when the bladder leaks. Now, urinary incontinence is more common in females and men because of their anatomy, but both do get it, right? Both have different reasons for incontinence, so we have to be careful. Not only that is inconvenient for the patients or you guys to have it, but it can also have a long-term side effects, for example, kidney failure. So it's important if you have incontinence to talk to your provider so they can take your good history, good pelvic exam, and then ordering the relevant tests, they can find out the source of incontinence, because not all incontinence or leaky urinary bladder have the same cause. Although there are common causes, but not everybody have the same cause. So unless you find out the source, you cannot fix it, right? So let's look at the anatomy. I'm going to bring a hologram up from the top here in front of you. You can see that the kidneys, they're getting the blood coming to the kidneys on both sides. It's getting filtered, and the clean blood is going back to the heart. And urine is coming back into the urinary bladder, and then it gets discharged, over a regular period of time or throughout the day to get rid of the toxins and extra fluid from your body, right? So we have a mechanism in our body where we can hold the urine and pass the urine only when we have to, or we have opportunity to do that, like in the restroom or other most appropriate places, right? So sometimes that mechanism fails, and that's called urinary leakiness. So there are three different kinds, and there could be mixed kinds. So I'm going to give you most common cause. Urge incontinence. So we have a receptor in the urinary bladder. You can see, bring me another hologram. You can see right here, there's a back of the urinary bladder. We call it trigone. So trigone, so trigone get inflamed or hypersensitive. So as the urine come from the urinary bladder, as the urine come from the kidneys, it touches the urinary bladder, it discharges urinary bladder and cause sudden urge to pass the urine. And sometimes it's so strong that if you're close to the restroom, you have to continuously keep going to the restroom. And sometimes you are so uncomfortable of your problem that if you go outside your home area, then you're constantly looking for restrooms. You go for dinners, lunch, or whatever, you're looking for the restroom. It will definitely affect the quality of life you have. So this important issue is become a painful issue. So we have to address that issue. Again, so we have urge incontinence, we have overflow incontinence, right? And the overflow incontinence is where the urinary bladder become like paralyzed. So the urine keep coming in till it becomes so full that the urinary sphincter just pops open and leaks the urine. So that is known as overflow incontinence. And then there's a mixed incontinence. You can have a little bit of both. And then there's leakiness of the urine due to the sphincter not working. The sphincter become loose. If you sneeze or cough, we call it like a pressure incontinence. So pressure incontinence is where there's a slight increase in the pressure of the bladder. If you cough or sneeze, urine leaks, because at that time, the pressure in the urinary bladder becomes too high to hold the urine, which would be normally most people can hold it. So again, as the source is different, the cause is different, the treatment is different. So let's talk about urge incontinence, where your urinary bladder becomes too sensitive. It happens, right, with certain medical conditions, with diabetes, neuropathies. It can cause spinal cord injuries. It can cause both kinds, urge incontinence or overflow incontinence. Urge incontinence, your urinary bladder works too fast. In overflow incontinence, it does not work at all. In pressure incontinence, the sphincter which just leaks, it becomes weak, excuse me, and that's in the females. In men, mostly you have overflow incontinence because the prostate become enlarged and it would not let the urine flow through or empty the bladder all the way through. And constantly the men have to go to the restroom to have that feeling that they still need to empty, and they keep trying to empty it, but the prostate is enlarged, the treatment is different. They can have other kinds too, but they're rare. So mostly men have overflow incontinence. Female have urgent incontinence. That's kind of common scenario, but obviously there's some variation.
The Dr. Fazil Show is now available to view at home on Roku devices and YouTube. Catch up on your favorite episodes right on your phone, available on YouTube and the BioFamily Clinic app. The Dr. Fazil Show is available in many doctor offices across Yuma, Arizona. Pick up your free copy of Health Tips magazine, available throughout Yuma, Arizona, or read our digital version at healthtipsmagazine.com.
How you treat it? Well, first you diagnose it. So the diagnosis is based on good history. Take the good history, and based on the gender of the patient, you will find out what kind of patient have incontinence, and then you can, take some appropriate testing, and that could be a sonogram of the bladder. You have the patient come with a full bladder, and then you have them drain out and see how much urine is left inside, and if it is more than 100 ml, then it is most likely overflow incontinence. But there are other tests too, which are done by the urologists, like urodynamic studies. You can see on the back of my presentation. That's a little bit more invasive. Sometimes they have to do a cystoscopy, look into the urinary bladder to make sure there's no mass or stone, because they can cause irritation too. Remember, so not just it is neuropathy or just natural aging process, but also some pathological processes as well can cause incontinence. As I said, bladder cancer, prostate cancers, prostate enlargement, or stones in the bladder. You can have stones in the urinary bladder as well. So the kidney stone can fall into the urinary bladder and might not go out because they're too big, and they can just sit in there and cause irritation. So urinary bladder stone can also be cause of urinary incontinence. So that needs to be looked into. Obviously, the treatment is based on your symptoms and your severity as well as the cause. For urgent incontinence, we try to reduce the inflammation. If we want to make sure it's not infection of the urine, we check the urine for infection. If it's an infection, you treat it with antibiotics. If it is due to hypersensitivity, then we treat it with medication like oxybutynin. And then we want to make sure that it is appropriate dose. Then we do another sonogram to make sure the dose is appropriate, and that helps quite a bit. Sometimes you have a urinary bladder prolapse, so that's not going to get fixed by medication. That needs surgery. So then you will be seeing the urologist, so they can do the lift procedure, so bring the urinary bladder back to normal position, so it does not start to leak all the time. So that's difficult to treat with medication. In men, obviously, if you have overflow incontinence, we treat it with medication which reduce the size of the prostate. For example, Flomax or Hytrin that open up the sphincter of the urethra. You can see in this hologram, you see the urinary bladder. Right here, you see the prostate, and in front of the prostate is there's a sphincter which actually becomes narrow. So you use that medication, Hytrin or Flomax, it works on that level, and then it causes it to open up. So you can drain the bladder when you go to the restroom. I'm gonna let this hologram go. All right, so let's talk about what are the other options, right? Well, with time, when people get, I will hate to say about older, but less younger, then they start to have atrophy of the urethra, especially in females. And lack of estrogen can cause it. So what we do, if there's no contraindication, for example, breast cancer or anything else, then they can use the estrogen cream to apply periodically or daily on the urethral area to improve the sphincter, and that can also help for that kind of incontinence, where the sphincter of the bladder become dysfunctional. Other option is PTN. Now, PTN is known as posterior tubular nerve stimulation. That's one of a very good technology where you come once a week for a few months, where the provider will stimulate the nerve at your ankle actually. And then that ankle nerve goes to your urinary bladder and cause it to constrict. And this constriction causes hypertrophy and improve the strength of the urinary bladder, right? So that's another option. Few non-medical treatments like timed urination, like go to the restroom at the time level. You can say, for example, 2 o'clock, 6 o'clock, 8 o'clock. Like you can see by time. Even if you don't have an urge, you go to the restroom and empty your bladder. So it does not fire up when you're in the wrong place at the wrong time, right? And you don't have any restroom. So that might also help with your symptoms of incontinence. So timed urination, finding the source, fixing the problem. Most common cause is sometimes urinary infection. That can cause incontinence too. That's the source, fix that, and go from there. So ladies and gentlemen, folks, this was my 10 cents on the urinary incontinence. So we'll talk more about other useful topic next time. Till the next time, Dr. Fazil Show. Have a nice rest of the month. I'll be back with the most useful topic for your benefit. At that note, I will call it a day, and God bless you and God bless America. Have a nice day. Dr. Fazil TV Show. See you next time. Thank you.